The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction. My first guest is an expert on the topic, Dr. Jeffrey Klein. Dr. Klein, welcome to the program.
Thank you.
All right, now before we get into today's topic, very interesting background training, because you're a board-certified dermatologist,
Right.
but you do all types of, cosmetic dermatology, a mixture of both?
I started out doing a lot of cosmetic surgery, but now I limit my practice to liposuction and some general dermatology.
Okay, and is that rare, by the way? Because look, our show airs throughout the United States and Canada, and I've only met two people. We said this off camera that like to do lipo. Is that true? Do you find
I
that?
really enjoy it.
But a lot of guys don't like it.
I enjoy it. I think it's an art, and it takes a lot of finesse.
Okay.
And I think the general perception is that it doesn't take much finesse, and it's a self-fulfilling prophecy. If you think that, that's what happens.
Now, the pretty much the standard of lipo today, Tumescent Liposuction, you invented that.
Yes.
Is that right?
Yep.
Not just the first guy to do it, but you
I
came up
invented
with
it. I published it.
Tell me about
showed
that.
that it was safe. Well, I started out early on in my practice, very interested in dermatologic surgery, and I took a course in liposuction that showed general anesthesia being used, and there was a lot of bleeding associated with it.
This was in the 80s?
This was in the 80s,
Okay.
early 80s, and there was so much bleeding, I said, oh my God, this isn't for me.
All right,
And
interesting.
Then I thought about it. I have an unusual background that besides my dermatologic training, I've been an NIH fellow in clinical pharmacology. So I started to think about why are we getting so much bleeding and what can we do to stop it? And the first thing I thought of was local anesthesia.
Okay.
And but all the anesthesiologists told me that you couldn't do it because you'd use too much local anesthesia and it would become toxic.
So that's what the Tumescent is?
Well,
this fluid?
The Tumescent is a very dilute form of local anesthesia. So we take one little bottle that is the maximum you can give a patient, but we put it in a big liter bag of saline. And that changes the whole pharmacologic properties. So rather than being absorbed very quickly, it's absorbed over more than 12 to 18 hours. So this means that when you put the local anesthetic in the fat, it stays there.
Okay.
It shrinks all the blood vessels, gets complete anesthesia.
All
so
right.
there's no pain and no bleeding. And
Is that right?
It's just like magic.
So you came up with it, and then what?
Well, then I had to very carefully do some research to show that the levels of the anesthetic lidocaine in the blood remain safe, never exceed toxic levels.
Okay.
And so once we established that, it became very popular.
And then you were teaching other doctors?
I teach a course on a regular basis. We usually have 12 doctors come to my office in Surgery Center in San Juan Capistrano.
Is that right?
We teach hands-on liposuction, a very intensive course in pharmacology and surgical technique. It's hands-on.
All right.
And over the years, about the last 14 years, we've taught over 700 surgeons.
So lipo, by the way, done properly, that's a safe procedure. One of the safest procedures?
Tumescent local anesthesia without general anesthesia is very, very safe. As far as I know, there have not been any deaths ever with this.
Is there art to it, by the way?
Lots of art.
A lot of art? There's
Lots
technically
of
demand.
skill,
You have to have an
lots
eye
of
for
art.
it, you think?
There's the technical skill or the art of being able to do it, and there's also the aesthetic, knowing how much to do and what not to do, when to overdo it, when you can overdo it, and when you should be very cautious.
All right, what's new, by the way, in the world of liposuction? Well, and then we'll get into some of these pictures you brought.
Well, I think everybody's talking about laser liposuction. It's a new method that's been available for about the last 2 to 3 years. It's become very popular, marketed directly to patients. So patients are very interested in it. As a consequence, doctors are very interested in it. But the doctors are still in the learning phase.
Okay.
They haven't really figured out all of the benefits.
You think it's oversold, by the way? Because when I hear it, I talk to doctors about it. And they're making it sound like, this laser goes in, just dissolves and melts the fat, and it just falls right out. And then they suck it right out. Yeah. Is that an overstatement?
I think it's an overstatement.
Okay.
Yeah.
Okay.
You have to be careful. When you're destroying tissue, you can destroy the right amount or you can destroy too much.
So laser lipo heats it and destroys it? Is that what you're talking
about? Heats it and destroys it. Whereas tumescent liposuction goes in, removes the tissue, and there's no damage to the tissue that remains behind. It's all viable.
So what's the benefit of that?
Well, you heal very quickly.
Okay.
And there's very little discomfort. There's very little inflammation.
Better results, you think?
I think there's better results.
Because you use a little bit of laser, you say.
I'll say right now there's better results. I do use laser liposuction.
You know, people ask me all the time for referrals. We go out of our way on our website not to refer doctors, you know. But I always say this, and no matter what it is, hip replacement, knee, whatever, go to somebody that this is what they do all the time. Find out, is this their specialty? Most guys, and look, I talk to doctors for a living, do lipo maybe once a month or rarely do it. And so the fact that you do it a lot, I mean, more in a month than probably most guys do in a year, does that make you better, you think? Better results?
I'm very careful not to be burnt out.
Okay.
So I could do many more cases per month than I do.
Right.
I'm happy to do just one a day.
That's good. That's a lot, though. That's more than anybody I've heard.
I do one a day, and I'm careful with it. And my shoulder doesn't get sore, my elbows don't get sore, and
You're also an athlete, right? I mean, you're a cyclist, so
yes.
you stay in shape for lipo.
And I have little kids, and I have to be able to wrestle with them.
Okay.
So I can't get hurt. Anyway, I don't like pain any more than anyone else does. And that's part of liposuction, tumescent liposuction. It's actually a relatively painless procedure, and of all the techniques for liposuction, is probably the least painful.
Is it
less painful than general anesthesia?
So what defines, by the way, a great liposuction? Is it just a smooth appearance, high volume of fat? What is it?
It's a happy patient.
Okay.
It doesn't matter. Nothing else matters.
All right.
If you think you've done a great job and the patient's not happy, you haven't achieved much.
Okay.
And so that's the most important thing. So I need to talk to patients and ask them very carefully what it is they want to achieve, and then be very honest with them and tell them, I can do that.
Okay.
And if I can't, I just say, you know what? I don't have the technical skills to achieve what you want me to achieve, therefore I shouldn't be doing this. And
okay, good.
with that statement, I basically eliminate patients who are going to be unhappy. So I just choose the happy patients.
You attract the positive patients. So let's talk about the areas. What are the most common areas of liposuction that you do? And do you call it liposuction, liposculpture?
Liposuction.
You call it liposuction. Okay.
I say tumescent liposuction.
Tumescent liposuction.
Just to emphasize the fact that it's under local anesthesia. We don't use general anesthesia.
Now, when you hear people, when you're out and about, since you invented tumescent liposuction, when you're out and about, do you hear people talk about lipo and you just go, if they only knew? The lipo guy is right here. No, I mean, but is it funny when you're out around and you hear lipo?
I hear that, yes. But now it's like everyone assumes that it's bloodless, and it's quick recovery, and the results are great, very smooth results, and that should be standard now. People know that they shouldn't use large cannulas because it causes more irregularities. They know they use micro cannulas, use small holes and small incisions, and leave the incisions open so that there's a lot of drainage.
So they drain.
You get a lot of drainage. With that drainage, then the healing process goes very quickly because they've eliminated all that inflammatory fluid that might be left behind if they close those sutures.
Interesting. So with the abdomen, starting there, I mean, is that the #1 procedure?
That's the most popular.
The love handles?
A very close second is hips and outer thighs.
Okay. Like saddlebag area?
Yes.
Okay. So with the abdomen for women, what area? Like in and around the belly button, after pregnancy?
It's typically after pregnancy, and as they're approaching middle age. Okay. Even women who exercise find that they're accumulating some genetically determined accumulation of fat on their abdomen, and they're very slowly beginning to look like their mother. And it's
is that what they tell you?
It's a wake-up call. Yes, they say, "Whoa, this is very reminiscent of someone I know well." And they didn't want to look that way.
So on the consult, what do they say? Okay, so they come in, love handles, abdomen specifically. What do they say to you? I mean, what are their insecurities?
Well, I will usually ask them, what areas bother you the most? And some women will say, right here.
Okay.
Other women will say, well, it's right here. And some women will say, from here to here.
Okay.
So, but you really need to ask them what is their most area of concern. And when we focus on that, we discuss that.
Because they still want to look pretty, obviously. After pregnancy, they want to look sexy and pretty. So you can flatten out that abdomen.
We can certainly make it look a lot better.
Because women wear low pants today, showing that abdomen.
Really, it's not having the perfectly flat abdomen, because sometimes that's not realistic.
Okay.
What we really try to achieve is a very, very significant improvement.
What are we looking at there?
Well, here's a woman. She was a lawyer. She spent a lot of her time perfecting her career, going to school. At the age of 34, she realized that her clock was ticking.
But she has a pretty good body.
She's a very nice,
very nice
figure. She has a very nice figure. And in clothes, she looked pretty good. But she was very self-conscious about herself in tight ski pants, and very self-conscious about herself in a pool.
So what'd you do?
Well, I asked her what bothered her the most, and she pointed it out, and I said, yes, that's an area that we can...
So inner thighs, outer thighs?
Inner thighs, outer thighs.
Do you go all the way around?
I don't do it at the same day of surgery because I think it's a little more risky. So I did her hips and outer thighs in one day. She came back another day and did inner thighs and knees. And there's an advantage of doing that. Not only is it safer, but she went back to work the next day.
All right. And does it allow you also to be a little more tedious or spend more time doing the small area?
This is, in my hands, in my perspective, this is an art and requires a lot of attention, a lot of compulsive attention to detail.
Is that right? Are you a perfectionist when it comes to lipo?
I'm a perfectionist. I'm compulsive.
Lipo fanatic?
Trying to get the very best result possible. I'll take more time and go more slowly if it gives me a better result.
Okay.
It's sort of selfish too because I virtually have no touch-ups for my patients.
Is that right?
Maybe less than 3% patients come back for a little touch-up. Whereas if you go fast, you're going to have a much higher percentage. So it pays me to do it right the first time. Do it right the first time.
Takes you longer. Okay, so women, so they come in, you get the lipo, and this is very interesting because we talked on the telephone, is that they also start taking better care of themselves after the lipo. What's your take on that?
Well, it's true. They feel good about themselves. They want to stay in shape. They now look good. They want to keep that. It's not that they're starving themselves and dieting and never achieving what they want. Now they really look good.
So it gives them leverage, you think?
They're getting compliments all the time, and that's a big motivation to not have that extra cookie and not have 2 pieces of pizza when one will do.
Yeah, so construction workers are whistling at them and yelling. I'm kidding, but so they... so in clothing, they look a lot better. So you didn't have to touch her abdomen. Is that right?
No, we didn't do her abdomen.
Because it looks good.
Yeah, she had a nice figure. This was the genetic problem that she had, and we were able to help her with it.
What about buttocks? Is that an area to stay away from?
That's an area that I do, not infrequently.
Okay.
But it's a very touchy area, simply because women want a nice round result.
Okay.
And any irregularities, dimpling would be a disaster. So you have to be very careful to do that. Use small cannulas, be conservative, get a nice result.
You know, you say conservative. I'm thinking I want to go to the doctor that's most aggressive, that takes all the fat off. I mean, if you're going to go get lipo, you might as well get it done to the extreme. What's wrong with that thinking?
Well, when someone says, take it all, doc, a red flag goes up and starts waving and says, be careful here.
Because it can look weird.
That's the biggest source of unhappiness among people.
Because of the uneven result.
Uneven results and having taken too much out.
And then they're embarrassed to show their abdomen.
This is a good example. This patient is a good example. She looks normal.
You can't tell.
She can't tell. She looks great. I could have taken a lot more fat out, but it wouldn't have improved it.
Wouldn't have looked good.
It would not have looked good. And
that's an interesting take on this.
And she would have had a greater probability of being unhappy. This takes one little hole in her thigh, a little dimple or a divot, that she would not feel comfortable wearing her bathing suit to the pool. She's very happy. She couldn't be happier.
All right.
And it's not because she has the most dramatic weight loss. It's because she has a very nice figure now, and it looks normal and feels normal. So if someone touches her, that area feels normal. There's fat there, but it's fat in the right places and the right proportion.
What about knees? What about knees? Or other areas?
It's a very common area of concern.
Really?
Yeah.
Is that an easy one? Much easier?
Well,
you go all the way around?
I do most of the time do the inner knee and very carefully do the anterior knee, but I don't promise the world because it's difficult. And again, there's an area that can easily be overdone, and that's a common mistake.
Now, are you ever surprised, like let's say the little saddlebag area or the thighs, that because this is a person, it's a very subtle result, but it's a nice result, that you change something in a very small way and you see changes in personality or a huge boost in self-esteem?
I see that all the time.
You do?
Especially, for example, a young man who has large breasts.
Okay.
He won't go to the beach, won't go to the pools, doesn't want to go to Las Vegas with his buddies because he doesn't want to take his shirt off at the pool. Remove that problem, do some liposuction, give him a flat chest, and all of a sudden he's going to the gym, feels comfortable going to the gym, he's working out, getting buff, he's got dates, he's just changed his life completely.
Yeah. Yeah. Now you have a picture of a chest.
Yes.
Right there. Let's go to that if you can.
This is a fellow who is in his mid-20s, and just as I described.
Is that right? 20s.
He was very self-conscious about that, and with a liposuction, he was just changed his life.
Now that's unusual, but is that unusual, or is there a lot of that going on?
It's not that unusual.
Because because he's not a real big, heavy guy,
No.
and then he just has fatty breast tissue.
It's fat. Yeah.
Interesting.
And it's genetic.
So these are guys that just don't take off.
The way it is.
They just don't take off their shirt at the beach. That's probably why I don't see them. Very self-conscious guy.
Yes.
And
Often these people are rather sedentary. They're not working out very much because they feel self-conscious about that.
Mm-hmm.
And now with the liposuction, he's at the gym. He's at the beach.
Couldn't just a lot of bench press take care of that?
No, that's fat. He could have great muscles underneath it, but the fat's there.
So even working out may make them bigger.
It might make
bigger breasts,
bigger chest.
So what do they say when it's done? Like a guy like this. Like, I mean, do you recall what he told you?
Well, he told me that now he was dating and he was working out, and it had changed his life completely. He was hanging out with his buddies, more social, happier social life, basically.
So there's a lot of people. What's the number one fear? Or look, you invented tumescent liposuction. You hear it. What's being said out there about liposuction that's just not true? That you hear maybe that drives you crazy or frustrates you?
That it's simple and safe.
Okay.
It is simple and safe from the patient's point of view. That's the way it should be.
Yeah.
But from the surgeon's point of view, it requires a lot of attention and a lot of care.
It does seem simple, by the way.
It's supposed to be simple for the patient. That's the idea. Come in, local anesthesia, get up, go home, cook dinner, and go on with your life. But behind the scenes, there has to be a very careful surgeon who knows what he's doing. He or she has had a lot of experience and is not too aggressive.
Because you have a different philosophy than, this is philosophical differences in other doctors doing lipo. Some guys come on, they use those power-assisted liposuction cannulas. We talked off camera. You don't like those.
No.
But you get it done a lot quicker, right? You could save time.
Right.
But you don't use them. Why?
It's not about saving time. It's about getting the best results.
Best result.
That saves me time. I get the best results. I never have to do a touch-up. That saves me time. But also, I have a happy patient. My personality is one that I don't like patients coming back and saying they're unhappy. So I'll do everything I can to avoid that situation.
Okay, so you have other photos. What else are we looking at here? Okay. What other areas of the body are you doing lipo?
Wherever there's fat. Here's a picture of a young woman who had a couple of babies, and now she's developed an abdominal collection of fat, and it's made her feel very self-conscious. Okay. She wears clothing that is different than she'd like to wear, and clothing doesn't fit very well. So she came in, and I asked her what was her main concern, and she put her hands right there.
All right.
So here on her anterior abdomen, you can see that there's a bulge both above and below, and when she put clothes on, it didn't look good. We did liposuction. That's the only area we did. And
so abdomen up high and low.
Up high and low.
What about the sides there?
On her, we didn't need to do that.
Okay.
So it's amazing. She just did that, and it made a big difference.
It looks nice.
Yeah. She was very happy.
And that makes probably a big difference when she's wearing a little black dress. Now she looks super fit.
She looks good in her clothes, and she's perfectly happy to go to the beach or go to the pool with her kids, and feels very self-confident. She doesn't feel too maternal.
All right.
Like looking too maternal. Very happy lady.
Now, do women bring in their partners in? Do you encourage that on the consult? Do they do that? Is that common?
I usually I encourage them to bring a friend or a partner.
Okay.
And it's usually so that when we ask good questions, they ask good questions. The partner can ask a question, the patient asks a question, and then they remember it too, because they're so involved in asking questions and getting the answers that some of it they can't retain.
Do you hear the same questions every day? What are the frequently asked questions you hear every day?
Well, the most common one is, what happens if I gain weight?
Yeah, good question.
It's a good question, because we all want to not gain too much weight, but it happens. So the answer is that after liposuction, they'll have a new shape. And if they gain weight, that new shape will get bigger or smaller. It doesn't necessarily go to other areas of the body.
Oh, it doesn't go to other areas of the body.
Well, it has to go somewhere, but the areas that we've treated, there's not much fat there anymore, so that there's not a storage depot for fat to go to. Okay. So other areas will get bigger. But one of the remarkable things is that women who tend to yo-yo in their weight loss up and down a little bit, they say that their clothes always fit better, even when they're on the upside of their desired weight, they can still fit in their skinny clothes.
How many dress sizes? I mean, have you heard that a woman has lost after lipo?
The world record is one thing, but what's common?
Yeah.
The most common is that their dress size goes down a size or so.
Okay.
But,
what's your world record?
But they fit into clothes and they look really great in their clothes.
What is your world record? And what have you heard? You said the world record.
4 dress sizes.
4 dress sizes after lipo.
I don't do all of it. I'm very conservative, so I don't do the whole body at once. And
because of better results, or because you're just cautious?
Well, I think it's
or both.
Let's face it. There have been deaths associated with liposuction.
Okay.
And they've always been associated with general anesthesia and usually with excessive amounts of liposuction on one sitting, on one surgical day. It's not safe. It's increased risk. So I don't go there. My goal is to have the patient feel good enough to go home and cook dinner. If they have,
really, they can do that.
I don't do more liposuction than that.
All right.
They don't go home and cook dinner. Usually they go home and take a nap. But I want them to feel good, and when they're walking out of my surgery center, they look as if they've just been there for a dermatology visit. They don't look haggard.
Okay. Now, so we talked about Tumescent. You're involved in research all the time. Are you getting better, by the way? Are you always, look, you invented Tumescent as a better way to do lipo. Are you always looking for, like laser and ultrasound? I mean, all these new, flash lipo. This jet lipo I heard the other day somebody wants to do. And what does all of this mean, and where's it going?
Well, liposuction is obviously a very popular procedure, so there are a lot of people looking for ways to improve it or ways to sell into that market.
Are you on top of it all?
I try to learn as much as I can about it all, but I'm not compulsive about trying to learn everything. My actual expertise is in the science of local anesthesia. And
that's the Tumescent.
Right, and safety. So when I look at a new device, my question is always, is this safe? And what are the complications? So I look at this a different way than, say, someone who's not doing the research.
But you use lasers, or is it an ultrasound? I mean, you use lasers most of the time?
I don't use ultrasound. I do use lasers.
Lasers?
I don't use it all the time, but we have it there for certain areas that I think might benefit. And I'm still learning. Like everybody else, there's not one surgeon in this country who's...
So it is an overstatement when I hear a doctor saying, it just dissolves the fat and it melts right off, and you just suck it right out.
It sounds too easy, and it's probably too simplistic. Actually, what the laser is doing is destroying cells.
Okay.
But
is that what you want?
No, you want healthy cells that are left behind so that there's quick healing. I'd rather suck it out and have everything left behind as healthy rather than destroying cells. Now, we don't know if there's a real strong benefit to laser or not yet. It's very popular.
But I hear it tightens the area too.
We hear that. We hear that, but we don't know that.
I mean, you're an expert on the topic. I mean, obviously you could do it any way you want.
Yes.
You do the Tumescent liposuction, laser sometimes, for the best results. Right. I mean, is that the takeaway message here?
Yes.
Okay. And what should somebody look for? I know you have 2 more photos. I want to show it.
Okay.
But what are people the main thing they need to know when they have to find a doctor doing lipo? I mean, you're the inventor of Tumescent lipo. What should they look for?
Well, they want to find someone who is a credible surgeon, has had a long history of being safe, and not someone who's just recently gotten into the market for the commercial value
of lipo.
Commercial value of lipo. So there are surgeons out there who talk a good game, but don't have the credentials nor the experience. And you have to be careful.
I mean, you do a lot of lipo. I mean, you do it every day. Yeah. You do it more in a month than most guys do in a year, actually. So you're always better. Are you better all the time? Are you better now than you were even just a year ago?
I'm always trying to get better.
All right.
It's like karate. I'm trying to get that next black belt, the next level.
Okay, good. Now, this guy right here. Let's take
here's a young man or a father.
All right.
Who was becoming a little bit middle-aged, and he had a spare tire that he was very self-conscious about. It wasn't there when he was young. And he's feeling uncomfortable with that, wearing a suit and just hanging out. So here he is. The after photograph, you can see the love handles.
Yeah, very nice.
Love handles are gone. The abdomen is nice and flat.
Guy's ripped.
He looks good and he feels good. He has a tan now because he's wearing no shirt. He's just wearing his Levi's around the house on the weekends, showing it off, I guess. But
looks like he lost some weight though, also.
He probably lost a little bit of weight, but now he's exercising, and you'd be surprised how little weight people lose and still look dramatically better.
Huge difference. I mean, this guy's just a smaller person. So do you go all the way around on this person?
On him, we went the abdomen and the flanks, not the back, but all 3/4 of the way
So you
around.
only do the back if they have fatty back.
It's very uncommon to people accumulate fat on their back. It's usually their hips, flanks, waist, and abdomen.
Okay. Neck.
Neck.
And we have time for one more photo.
Here's a young woman. She's probably in her late 40s, early 50s.
Okay.
And she looked in the mirror one day and said, "Uh-oh, I'm starting to look like my mom."
Okay.
And so she chose to have liposuction. And some women need a facelift, and some would do better with just liposuction because it's simple and safer. And here we did liposuction. You can see in the before picture, she has a little jowl there, as well as a neck that makes her look like she's almost ready to be a grandmother. And here she looks much younger. And,
yeah, it does. Makes a huge difference.
The jowl is gone. And
she looks fit, too.
She looks fit, and she looks a lot thinner. Just that.
So the skin bounces back, by the way?
Skin bounces back.
We haven't talked about arms, and I want to ask you a question about arms. So women's arms, popular area?
It's a popular area, but...
You like doing it?
I like doing it, and that's probably the area that heals the fastest.
Really?
But there's a danger there. That fat is pretty soft, and it comes out very quickly, and it's easy for women to have too much liposuction there, and then they're devastated because you can't hide that area. You can hide
what looks bumpy.
It looks bumpy. It looks irregular. If it's done on the thigh, you can wear pants, but on your arms, they're exposed, and it's not a happy situation.
It's a tricky area.
It's a tricky area.
But you like it.
Use very small cannulas. Be very cautious and get nice, smooth results, and then you've got a happy patient.
And you get you wear the sleeveless dresses, things like that.
Sleeveless dresses, and be a real Californian.
All right. Okay. Final message. Somebody watching this, they're thinking about lipo. Okay, what's the first step? I mean, your website, a lot of information on your website.
A website.
They call you directly, call your office.
KleinLipo.com.
Okay.
And they call my office, and we'd be happy to see them in a consultation. But I think that when you're looking at yourself in the mirror and you say, gee, this little area bothers me, you can do something about it. And you can do it in a way that has a high probability of success and very safely.
All right. I want to thank you for coming to the show. Very interesting.
My pleasure.
Good for you. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to direct a friend to this interview or see it again, you can visit our website on wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.